Hi, we are Group 2 and we will be presenting Ibuprofen.
Hi everyone, today I will be introducing ibuprofen and discussing its main uses and the conditions it treats. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID. It was first introduced in 1969 as a safer alternative to aspirin. Today, it is one of the most commonly used medications worldwide and is available over the counter for common conditions, while higher doses may be obtained through prescription. Some of the well-known brands include Advil, Motrin, Nurofen, and Brufen. Ibuprofen has three main therapeutic uses. First, it acts as an analgesic, meaning it helps relieve pain. Second, it functions as an antipyrectic, which means it can reduce fever. Third, it has anti-inflammatory properties that can help reduce inflammation associated with various medical conditions. Because of these effects, ibuprofen is commonly used to treat a wide range of conditions. For pain relief, it may be used for headaches, migraines, toothaches, muscle pain, back pain, and sports injuries. It is also used to manage inflammatory conditions such as osteoarthritis, rheumatoid arthritis, sprains, strains, and tendinitis. In addition, ibuprofen can help reduce fever associated with common infections such as colds and flu. It is also widely used to relieve menstrual cramps, also known as dysmenorrhea. Ibuprofen is commonly used by both adults and children when taken at appropriate doses. It is often chosen for the short-term management of pain, fever, and inflammation in both home and healthcare settings.
Pharmacodynamic of ibuprofen, which refer to how the drugs work in the body. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID, that produce analgesic, anti-inflammatory, and antipyretic effect. Its mechanism of actions involve the reversible inhibitions of COX enzyme, especially COX-1 and COX-2. This enzyme help produce prostaglandin, which are chemicals that cause pain, inflammation, and fever. By inhibiting COX activity, ibuprofen reduces prostaglandin synthesis, leading to reduced pain signaling and inflammatory response. As a result, ibuprofen has the three main effects. First is analgesic to release pain. Second is anti-inflammatory agent by reduce swelling and redness. Third is act as antipyretic agents by lowering fever throughout its actions on the hypothalamic temperature regulation center. After oral administration, ibuprofen is rapidly absorbed rich pitch plasma concentrations within 1 to 2 hours. It is highly bound to plasma protein and distributed throughout the body. Ibuprofen is primarily metabolized in the liver by cytochrome P450 enzyme and converted into inactive metabolite. It is then excreted mainly throughout the kidney and has a short half-life of approximately 1.8 to 2.2 hours.
As with any other medications, ibuprofen also has some side effects. The common side effects are mild and may improve as the body adjusts to the medication. They usually do not require medical attention unless they are persistent. Some gastrointestinal effects include stomach pain or cramping, mild abdominal discomfort, heartburn, indigestion, bloating, gas, nausea or vomiting, and diarrhea or constipation. Some nervous system effects include headache, drowsiness, fatigue, dizziness, or lightheadedness. An individual should stop taking ibuprofen and seek immediate medical care if they experience any of the following. Gastrointestinal effects. Ibuprofen can irritate the stomach lining, causing indigestion, nausea, abdominal pain, gastritis, or stomach ulcers. Long-term use may increase the risk of gastrointestinal bleeding. Severe stomach irritation can lead to ulcers and bleeding, which may present as black tarry stools or vomiting blood. This risk is higher in older adults and those with a history of ulcers. Cardiovascular effects. Long-term or high-dose use may increase the risk of heart attack and stroke, especially in individuals with existing heart disease. Ibuprofen may cause fluid retention and elevate blood pressure, particularly in those with hypertension or cardiovascular disease. Renal effects. Ibuprofen can reduce blood flow to the kidneys, potentially causing impaired kidney function, especially in dehydrated individuals or those with pre-existing kidney disease. Allergic reactions. Some individuals may develop rashes, hives, swelling, wheezing, or severe allergic reactions such as anaphylaxis. This is more common in people allergic to aspirin or other NSAIDs. Liver effects. Although uncommon, ibuprofen can cause liver injury, leading to symptoms such as jaundice, yellowing of the skin and the eyes, and dark urine. Some precautions to be followed when on ibuprofen include taking it with food or milk, as it can help reduce stomach irritation and lower the risk of gastrointestinal issues. Consulting a healthcare professional regarding high-risk conditions and pre-existing health issues such as cardiovascular disease, gastrointestinal issues, kidney or liver impairment, asthma, active stomach ulcers, history of gastrointestinal bleeding, known allergy, and high blood pressure. Only after consulting a healthcare professional should they avoid using ibuprofen or use it with caution. They should also be aware of drug interactions, as ibuprofen may interact with blood thinners such as warfarin, other NSAIDs such as aspirin and naproxen, corticosteroids, SSRIs, SNRIs, antihypertensives, and diuretics. Ibuprofen should also be avoided during pregnancy and breastfeeding, particularly during the third trimester of pregnancy, unless they are specifically advised by a healthcare professional, as it may harm the fetus or affect labor. Alcohol consumption should also be limited while taking ibuprofen, as it can increase the risk of stomach bleeding and irritation.
Hello everyone, and now we are going to explore alternative pathways to ibuprofen for managing pain and inflammation. First, we are going to look at the mainstream pharmacological alternatives. First, let's look at the primary over-the-counter and prescription options. If your goal is pain and fever reductions, but you must avoid gastrointestinal irritation or antiplatelet thinning effects, acetaminophen or paracetamol is the gold standard. Unlike ibuprofen, it is not an NSAID. It acts predominantly with the central nervous system to elevate our parental health rather than targeting peripheral tissue inflammation. This makes it incredibly safe for patients with gastric ulcers or kidney disease, provided we strictly respect the daily limits to protect the liver. Conversely, if you do require a traditional systemic anti-inflammatory but suffer from dosing fatigue, naproxen is an excellent alternative. It belongs to the same NSAID class as ibuprofen, but it features a significantly longer half-life. This extends its therapeutic window to convenient 12 hours, making it highly effective for sustained relief from chronic joint pains or menstrual cramps. For managing chronic low-grade inflammation without long-term synthetic pharmaceuticals, we look to natural compounds with robust clinical backing. The first one is turmeric. Specifically, its active polyphenol curcumin. Curcumin works at a molecular level by downregulating pro-inflammatory cytokines and inhibiting the COX-2 enzyme, essentially mimicking the therapeutic mechanisms of modern NSAIDs. To maximize its efficacy, it should be paired with black pepper, which contains piperine to drastically boost its bioavailability. The second one is ginger. Ginger contains bioactive gingerols and shogals that uniquely inhibit both the COX and LOX inflammatory pathways. Dual inhibition makes it incredibly potent for acute muscle soreness and dysmenorrhea. Finally, the omega-3 fatty acids. Typically, it is sourced from high-quality fish oils. Biochemically, omega-3s compete with arachidonic acid to shift the body's synthesis away from pro-inflammatory alkonoids and toward anti-inflammatory pathways, serving as a foundational supplement for long-term joint health.
Now, I would like to share some interesting facts about ibuprofen. First, let's look into how ibuprofen works. Ibuprofen helps reduce pain and inflammation by blocking the production of chemicals called prostaglandin in our body. These chemicals are responsible for triggering inflammation and sending pain signals to the brain. By reducing prostaglandin production, ibuprofen can effectively relieve symptoms such as headaches, muscle pain, and fever. Another interesting fact is that ibuprofen works relatively quickly. After taking it, the body absorbs the medication rapidly, and pain relief can usually begin within 1 to 2 hours. This fast action makes ibuprofen a popular choice for managing temporary pain and discomfort. In addition, ibuprofen was originally developed in the around 1960 as a safer alternative to aspirin. Researchers aim to create a drug that could provide similar pain-relieving effects while causing fewer gastrointestinal side effects compared to older anti-inflammatory medication. Lastly, ibuprofen belongs to a larger group of medicines known as non-steroidal anti-inflammatory drugs. Other well-known members of this family include aspirin and naproxen. This medication shares similar function in reducing pain, inflammation, and fever.
This is our references.
From this assignment, I gained a deeper understanding of ibuprofen's mechanisms as a non-selective COX inhibitors that blocks prostaglandin synthesis to reduce pain, fever, and inflammation. Ibuprofen is also often used for conditions like arthritis, highlighting how important ibuprofen is. Because it inhibits COX-1, improper use can lead to gastric and renal protections, which teaches us that even the over-the-counter prescription can cause a problem if we don't follow the guidelines of the medicine.
Through these video assignments, I gained a deeper understanding about ibuprofen, including its mechanism of action, therapeutic effects, and potential side effects. Before completing this task, I knew ibuprofen mainly as a common pain reliever, but I learned that it works by inhibiting cyclooxygenase enzymes, which reduce the production of prostaglandins responsible for pain and inflammation. This assignment also improved my ability to research and also evaluate scientific paper from credible source. Overall, this experience enhanced me, increased my knowledge and increase my knowledge of pharmacology and my confidence in presenting information about ibuprofen.
Prior to this assignment, I was largely unaware of the more severe side effects of ibuprofen. I was familiar with the more common side effects as several of my family members have experienced them to some degree with ibuprofen before. For instance, my parents reported feeling fatigued after taking ibuprofen for toothaches. The research to contribute to my portion of the assignment largely expanded my knowledge of the drug and its mechanism, leading to a deeper understanding and appreciation for it while also acting as a cautionary tale for how lethal even seemingly simple over-the-counter drugs can be in larger doses.
Through this project, I gained a deeper understanding of how ibuprofen works. Before, I only knew it was used for pain and fever, but now I understand that it inhibits COX enzymes to reduce prostaglandin production, which explains its effects on pain, inflammation, and fever. I also learned more about the wide range of conditions it treats, not just headaches and fever, but also menstrual cramps, arthritis, and other inflammatory problems. As someone allergic to ibuprofen, I experienced swelling and rashes as a child when it was given for high fever. So this made me realize the importance of recognizing side effects and considering patient-specific factors when choosing safe and appropriate treatment. Overall, this assignment helped me connect the drug's mechanism, therapeutic uses, and risk to its role in improving patient care, and it showed me why alternatives are sometimes necessary for certain individuals.
From this assignment, I learned that ibuprofen is not just a painkiller, but also work by reducing inflammations and fever throughout inhibiting prostaglandins production. I also understand its pharmacokinetics better, such as how is it absorbed quickly in the stomach, metabolism in the liver, and elimination through the kidney. Besides that, I learned that even common drugs like ibuprofen can have side effects like stomach irritation, so it must be used carefully. Overall, this task helped me understand how widely used drugs work in the body and how important it is to balance its benefit and risks in the patient care. Thank you for your attention.